Hello, I'm Irvine Mayor Christina Shea. With me today is Vice Mayor Mike Carroll and UCI Professor of Infectious Disease, Dr. Susan Wong. Let me start by saying how proud I am of our community for your strength, your sacrifice, and commitment to fight against COVID-19. I observed firsthand your dedication to our protective face mask resolution this past weekend, as I, along with Councilmember Kuo and other volunteers, personally distributed protective mask coverings to our local business community. As of today, there are 118 confirmed cases of COVID-19 in Irvine and 1,691 in Orange County. Irvine continues to have one of the lowest percentage rates of infection in Orange County based on population, and we have no confirmed deaths. As we all work to flatten the curve of COVID-19, many are wondering when our economy will again open. The city of Irvine is following the direction of Governor Gavin Newsom, whose stay-at-home order has no set end date. Instead, his framework for reopening the Golden State will be predicated by our ability to expand testing, to protect seniors and high-risk individuals, to provide protective gear to hospitals, to find therapies and treatments, and to ensure physical distancing in businesses and schools can be adhered to, and finally, to develop enforcement mechanism to allow the state to pull back or reinforce stay-at-home orders if need be. With so many of our local businesses closing and nearly 7,000 employees unemployed in our city, the city is seeing major cuts in our revenue stream. I'm working with our staff to bring forward a review of our fiscal model in relationship to COVID-19, which will be discussed in detail at our upcoming City Council meeting on April 28th. The city has spent many years thoughtfully preparing for a downturn in the economy such as this, and because of that, we now have $113 million in reserves and we have no city debt. But this isn't the time to sit idle. We will discuss certain belt-tightening measures to make sure that the city emerges from this pandemic in good fiscal health. Please know I'm also working with a coalition of mayors advocating to secure funding for our community. Local leaders understand the need of their residents and are best positioned to make emergency management decisions related to the allocation of resources from the federal government. In particular, there is a proposal at the federal level, H.R. 6467, which would provide $250 billion in direct aid from the federal government to local governments as we face this challenge. I will continue to work on your behalf and do what is necessary to ensure the health and the safety of our residents. And now here's a special message provided to us by Dr. Susan Wong of UCI. Thank you.
My name is Susan Huang. I'm professor in the Division of Infectious Diseases at UC Irvine School of Medicine and the Medical Director of Epidemiology and Infection Prevention at UC Irvine Health. It's my great pleasure today to address the city of Irvine. I live in Irvine, and I'm really pleased to be able to talk about where we've been, where we are today, what do we have to look forward to. So the most important thing that we can rest assured in is that the way this thing is transmitted is not through our skin, not through our clothing, not through our hair, but all about this area right here. It has to come into our mucous membranes of our eyes, our nose, and our mouth. And as long as we protect ourselves in this space, we will not be able to be infected with COVID-19. So how do we do that? We do that in several ways. The first thing we do is we distance ourselves 6 feet from the next human being. And that's because at that distance, their shouting and droplets can't reach us, can't actually reach our face. The other thing that we do, of course, is that we can wear a mask. The mask does two things. It stops my droplets, if I happen to be infected, from going out to someone else, and it stops someone else's droplets from coming to me. And that's really important. What we don't know how to do, though, as Americans, is we don't know how to wear the mask correctly. We are not a society that normally wears masks. It's very unintuitive to us. So putting something on our face makes it bothersome. We want to touch it, we want to move it, we're not used to it, it's hot. So one of the most important things that we need to remember is that if everything about protection from COVID-19 is here in this area with the face, you want to keep the face clean, and that means you want to keep your mask clean. So every time, and I mean every time, that you want to touch that mask with your hands, you need to clean your hands. Clean hands up to your mask. When you're done fiddling or adjusting your mask, clean hands again. And that's really hard to do because you don't carry your kitchen sink with you everywhere that you go. And so we recommend that you actually have some portable hand sanitizer. You can carry that anytime you need to, and your mask is falling down, you can clean your hands, readjust it, and clean your hands again. The other thing that we want to talk about is, let's say we do all these things, this is our new normal, we know how to clean our hands, we know how to wear a mask, we know how to take care of someone, a loved one who's in the same household, a close friend who needs some help. So then the question is naturally, where do we go from here? We have had a really, really terrific response to the stay-at-home order. It's been difficult, but we can see when you look at the case counts of COVID-19 that we have absolutely plateaued. And in fact, not only have we plateaued, but if you look at the intensive care unit cases, they're actually dipping downward. So there's some hope that all of this is really being able to give us a real buffer zone because of all the hard work that everybody has had to do and all the sacrifices of the businesses who have to really stay at home. It's in this setting that we have some hope to think about the guidance for when we might be able to loosen up some of the socialization, possibly have a gradient to allow things to go back to work, think about how to restore the economy. And one of the things that we're going to have to look at very carefully is the case count. For example, the future is looking pretty bright. We have longer days. It's springtime. We're hopeful that things have plateaued. And it very well might be that this virus, in fact, has a seasonal propensity so that it's harder to transmit when it's warmer and harder to transmit when it has higher humidity. And if that is true, we might be able to take the opportunity over the summer to do this balancing act, this delicate dance between the number of cases of disease and the reopening of business and the economy and society. However, if it is in fact seasonal and we reap some benefits in the summer, then we might have a detriment in the fall. And we're all going to have to be incredibly thoughtful about gathering data, watching how it performs, the virus, in the summer, and thinking about how it might then perform when temperatures drop and the humidity drops. And especially, probably the greatest area of uncertainty is whether or not children should be put back into school. We know that children really don't have a lot of symptoms with this virus, and we know that a lot of grandparents are the dominant care provider in after-school times. So we want to be really thoughtful about protecting the vulnerable, the older, the elderly, and certainly the people who have chronic conditions. That type of balance can be made possible with data, and we can give some information with mathematical models. We can give information by the serology testing, and it can really influence how we make decisions on a day-to-day, week-to-week, and certainly on a month-to-month basis. It's been a wonderful pleasure to be able to speak with you, and I wish you all being safe and sound both today and in the year to come.
Hello, I am Vice Mayor Mike Carroll, and I would like to update you and share some of the things that our city and people like you are doing in our community during this difficult time. Since this crisis began, the city of Irvine has delivered 17,892 meals to our seniors, to those with disabilities, and to at-risk residents. We put in place a COVID-19 hotline that thousands of you have called to get information and assistance, and that number should be right here on your screen. Please use it. We encourage it. We've also established a special community support hotline to assist those that are having trouble obtaining food or basic necessities, and that number is 949-724-6926, and we urge you to call if you need help. Residents can also call this hotline to request wellness checks on neighbors and loved ones. Let us know if you're concerned about someone. We'll go out there, we'll make sure everything's okay, and provide help that they need. We will not let anyone who is in need of assistance go without help. That is our city's commitment to you. And to our residents, your personal efforts to fight this pandemic are acknowledged and they are appreciated. Whether you're physically or virtually volunteering your time and talents, helping your children with distance learning, or staying at home and keeping updated with important information, each one of us, in our own way, is playing a critical part in fighting back. And the data is clear. It is working. We recognize that it takes real sacrifice to do this, and I want you to know that we are doing everything in our power to get our city back to normal as soon as possible. As you go about your day, find ways to exercise and keep moving if you can. Passive activities like walking, jogging, and cycling are all permitted at this time. Just make sure that you maintain 6 feet of space from others. These measures are important, and again, know that they slowly but surely are working to control the spread of infection. While this is a difficult time for all of us here in Irvine, it is really inspiring to see the creative ways that people are communicating with one another and coping with the challenges during this pandemic. We understand that it can also be a traumatic time for many. Please, if you need any assistance at all, do not hesitate to call us. We are here to help. Thank you.
Thank you, Vice Mayor Carroll. I would also like to thank Dr. Wong for taking part in our press conference today. I want to once again encourage our families to stay safe. For any information or help you may need, please refer to our website or call us. We are here to help you. I am Mayor Christina Shea, and thank you so very much for watching today.